Hi, my name is Alyssa. In this reflection, I will discuss how to apply the clinical judgment measurement model when caring for patients with chronic illness. As nurses, we know that chronic illnesses such as diabetes, heart failure, or COPD require more than just the management of symptoms. They demand continuous assessment, patient education, and collaboration to promote long-term health and independence. Through this reflection, I will demonstrate how I will use my clinical judgment to make safe, evidence-based decisions for my patients. The first step in the clinical judgment model is to recognize and analyze cues. When caring for a patient with diabetes, for example, I'll observe signs like fatigue, poor wound healing, elevated blood sugar levels. I will review the patient's medical history, lifestyles, and their support system to understand the full context of this patient. Recognizing these cues can help me identify patterns that may indicate complications or barriers to self-management. Next, I will prioritize hypothesis and generate solutions. Based on my assessment, I may identify risks such as infections, knowledge deficits, or ineffective medication management. Using evidence-based practices, I will prioritize what poses the greatest risk to my patient's safety and health. From there, I'll develop an individualized intervention such as teaching proper insulin administration, dietary management, or foot care or wound care to help promote stability and prevent complications. Next step is to take action and evaluate the outcome. I will implement my care plan while monitoring the patient's response to my interventions. For instance, if blood glucose levels begin to stabilize, the patient demonstrates accurate self-monitoring, I can see the impacts of my nursing judgment. If outcomes aren't achieved, I will reassess and modify the plan to ensure that care remains patient-centered and adaptive to changes. Through this process, I will apply the nursing process, assessing, planning, implementing, evaluating care with sound nursing judgments supported by evidence. Using the clinical judgment measurement model, I will ensure that my decisions are thoughtful, data-driven, and individualized. This approach not only supports the patient's physical health, but also their emotional and educational needs to improve overall quality of life. This demonstrates my achievement of the student learning outcome number 2 as I interpret functional health and illness management to guide my care decisions. The end of program student learning outcomes number 2, as I apply the nursing process to provide safe, quality care across the lifespan. Thank you for listening to my reflection. As I continue to grow as a professional nurse, I will be using my clinical judgment model to help me provide compassionate, evidence-based care that's adaptive to the complex needs of every patient I take care of. Thank you.